Hello everybody and welcome to this information seminar about postgraduate study at Ulster University. We're delighted that you're able to join us today and looking forward to being able to talk more about your opportunities and choices with postgraduate study at Ulster University. So first of all, just to introduce myself, my name is Dr. Leslie Dornan and I am the new course director for the MSc in Health Promotion and Public Health. And the aim of this course is really developing knowledge and skills for public health practice. So to start with, I'm going to speak a little bit more generally about some of your opportunities in relation to postgraduate study in Ulster University and the aims and objectives that we have as staff and as a university to be able to support you in your learning journey. And then we'll go into more detail about the actual MSc Health Promotion and Public Health course. So I hope you'll find this information session helpful. So just to start out, so what are some of the benefits of studying at Ulster University? Well, we have some excellent conversion courses. If you are interested in changing career, changing direction, or increasing your learning opportunities, you'll get a competitive edge within employment. We have a lot of links with different employers and different partners and stakeholders within industry. Studying at Ulster also gives you an opportunity for personal fulfillment. There's something about having and taking the time to study and to gain new knowledge and skills that can bring a considerable amount of fulfillment at an individual level. You'll be taught by experts, both industry experts and experts within fields as well. And you'll be supported within your study environment by lectures, but also by a wide range of other resources that are available within the university. You'll be taught by people who have both academic and professional qualifications. And as I said, we do have a lot of links with industry bodies and employers, and we do our best to be able to work to connect you with those. So, what kind of quantifiable benefits are we talking about? Well, I think the first one is just to recognize that actually when you take on a postgraduate study and you take the opportunity to increase that knowledge base that you already have as a graduate, actually the opportunity is for an extra £7,000 is the average amount that a postgraduate student would earn in comparison to a graduate student. 21% of postgraduates are more likely to be employed in a high-skilled environment, and it also increases your earnings. And the Department of Education has shown that earnings and employment is increased in light of taking postgraduate opportunities too. So what are some of the things that are available for us from Ulster for postgraduate study? Well, we offer flexible modes of study. You have the opportunity to be able to study full-time or part-time, and on some courses you also have access to distance learning courses as well. We also have flexible study levels, so you can do short courses or you can do a postgraduate certificate, a postgraduate diploma, and that can then lead into either an MA or an MSc as well. So we have a wide range of ways of facilitating you to be able to get involved in postgraduate study. We work with a wide range of industry networks, including professional bodies that will give accreditation wherever possible as well. And we work hard with our industry partners to be able to help and support you during that process. So if you are thinking about applying to Ulster University, well, how do you do that? Well, you can apply online at ulster.ac.uk. And while there's no official closing date for most courses, applications are rolling. Course places can be limited. And so it is helpful if you can apply early to secure your place if you have already decided which course you'd like to do and the course that you want to apply for. You can apply for multiple courses, although separate applications are required for the courses. So make sure that whenever you're going through the process, you fully complete the application. And if in doubt, please do contact us and we will be happy to help as well. So when you're looking at the fees and finances, the courses start from £6,270 for this academic year 21 to 22. We have flexible payment options that are available. And if you have already been at Ulster University, then there is opportunity for a 10% discount and a 5% discount for upfront payment as well. But you can also take loans of up to £5,500, which are available for you too. So if you are interested in more information on this, then please do check our website, ulster.sac.uk, for up-to-date information on the fees and the finance options that are available for you. So why Ulster University? Well, we have 4 campuses, and each of those campuses are unique across Northern Ireland. We have Magee campus, which is in Londonderry. We have Coleraine campus, which is up in the north as well. And then we have Jordanstown campus, which is in Newton Abbey on the Shore Road, as well as our new campus, which is the Belfast campus in the centre of the city. And each of those campuses offers a range of different courses. Depending on the course that you're interested in, obviously, then we will be able to link you to the correct campus. But although we have the 4 campuses, we are still very much one university, and we operate from a shared ethos and a shared drive and vision to see you succeed. For our course that I'm talking about today, for the master's course in Health Promotion and Public Health, this course is run out of the Public Health Division in the School of Nursing, and for this year that will be run from our Jordanstown campus too. So the basis of the classes and face-to-face teaching will be done within the Jordanstown campus. So who should apply? Well, really, if you're thinking about opportunities, or if you're thinking about a career in public health, then this is a really good course for you to consider and apply for. To be able to apply for this course, you need to have a relevant honours degree. You need to have competence in both written and spoken English as well. And if you're applying as an international student, then we would be looking for an IELTS requirement of 6 with a no banding less than a 5.5. So those are some things to consider. Our unique selling point. Well, as I've mentioned already, we pride ourselves on our inclusive approach, and that really extends to many different areas. If you're contemplating a career within public health or health promotion, or if you're interested in taking more time and more opportunities within your academic career as well, this Masters in Health Promotion and Public Health will enhance your prospects. On completion of the Masters, there will also be opportunities for you to be able to apply to become a registered public health and/or health promotion practitioner too. And as we've already mentioned, we have a lot of links between employers within public health and health promotion, and we also have academic staff. But we work hard to try and make sure that the course content each year is relevant to the contemporary public health practice. And as you can imagine, certainly this over the last 18 months or so, with the impact of COVID, public health has become an increasing focus, and there is a recognition of both the value and the importance of health promotion and public health in today's world as we continue to navigate the impact of the COVID-19 virus. So what is this course about? Well, overall, this course addresses a number of different aspects. We look at the emerging needs and the global public health challenges that we're facing in today's world to protect and improve the health and well-being of populations. We focus a great deal on the evidence-based approach, and our aim is to provide you as students with the knowledge and skills to be able to understand how to assess the needs in families, in communities and in populations, and to evaluate public health and health promotion interventions and strategies. We incorporate both public health and knowledge frameworks into your learning across the board, and there is very much a focus on that integration between theory and practice. And there is an opportunity, depending on COVID, that we would like you to be able to be involved in work-related learning placement as well. But as I've mentioned, with some of the challenges of COVID, that will need to be evaluated each year. So this is just a diagram that gives you an example of the different modules. So one of the modules that you would be studying will be the Principles, Skills and Information Systems for Health Promotion and Public Health, and that's worth 30 credits. At the same time, in semester 1, you'll also be studying Advanced Methods in Research and Development in Health and Social Care, and that is worth another 30 credits. You'll then be able to move on to study epidemiology and policy for public health and project planning and public health practice as well. And that will lead you towards your postgraduate diploma, from which you will then be able to continue on to do your master's project. And that is giving you an opportunity to do a unique master's project, which will lead then to your Masters of Science qualification. So just to give you a little bit more information about each of these modules that you would be studying if you were taking this course, the principles and skills and information systems for health promotion and public health really provide you with that basis for the study and the foundational understanding of health promotion and public health. And as part of the course, we look at the philosophical underpinnings of public health action. And that would include things like the determinants of health and the impact of health inequalities on the broader perspective of health as well. We'll explore the approaches and methods for promoting health among the different populations and with a focus on the vulnerable populations. We'll also be looking at the global public health perspectives, because as we've seen across the last 18 months, we live very much within a global public health environment. And public health messages are not just restricted to the local environment, they also have to incorporate and take into account the global public health perspectives too. We will be running information around information literacy skills and leadership philosophies, because leadership is a key element of public health and health promotion too. And then looking at project management techniques. How do you learn to manage projects successfully? How do you move from the very beginning stages of a public health or health promotion project right through the aims and objectives to the methodology that you'll be using, and on through that to the outcomes and the evaluation? And through that, we'll also be exploring professional competencies and surveillance and monitoring systems too. Within the epidemiology and policy for public health, then we would be exploring the capacity and capability of US students to be able to use the demographic statistics and epidemiological data and analysis to focus on improving the health of the public. And that really is looking at the different demographics and the biostatistics that are available. It's understanding health equity and health impact assessment. It's enabling you and supporting you to be able to design studies and critically appraise epidemiological studies as well. So really to be able to go in depth with the different epidemiological studies. This course will allow you to be able to explore things like chronic disease epidemiology as well, the impact of chronic disease and how that is spread across populations, and then exploring the importance and the value of health economics for public decision making. As part of this course, you will also be looking at evidence-informed health policy brief and how you design that and implement that, and policy analysis. And then you'd also be exploring and analysing local, national and global policies and the impact of health regulators and governance and the value and importance of that on public health too. The next module, Project Planning and Public Health, will be giving you the knowledge and skills to be able to propose, plan and manage public health focused projects, and to provide an insight into how you would implement those into a public health setting. And this will be learning things like health needs assessments, how you actually assess the needs of populations on the ground and set the priorities on those findings, how to plan and approach and to build a project team, how you would be able to build a business case, maybe for funding or to be able to move forward with the project, and then the implementation of the project and the programs too. You'll then also learn how to evaluate public health projects and programs and how important that is, both in terms of the success of the project that maybe you have been exploring or implementing, and also planning for future projects as well. And finally, the application of public health competencies and the values to practice, because ultimately any work that we do within public health always needs to return back to our own competencies and the core values that are integrated into public health and health promotion. And then you will also be doing a research module, which is the Advanced Methods in Research and Development Social Care. And this module gives you an opportunity to really be able to explore in-depth knowledge and capacity and develop your critical analysis skills of both the methodological and philosophical issues that exist these days in research, and also within service evaluation and project developments within health and social care. And these can be across a very wide range of topics. They can apply across nursing and across health promotion, across the different public health elements too. But the focus of this module is looking at things like the research paradigms. It's understanding the research processes, how you develop a research question, the research problem generation, and how you identify a topic and explore that topic. And this will help you to lead you into your master's, the master's element of the course, looking at qualitative research, looking at quantitative research, and to be able to gain a deeper understanding of what it actually means and takes to be able to design a research project and follow the ethical and research governance principles that they are implemented within your application as well. And then through the practice development, service improvement methodologies, and qualitative improvement. And some of those are broader and are recognised to be able to work within the broader setting as well. Okay, so those modules will then, as I said, lead you into your master's project. And this is an opportunity for you to be able to complete an independent project as part of your master's program. You will have supervision and guidance by an experienced member of our staff. You'll have optional workshops that you'll be able to attend that will provide additional learning for you. And you will be able to plan and carry out a public health or health promotion project. Now, it is very important to note that as part of this process, you will also be applying for ethical approval, and that is mandatory for you to be able to do this part of the course. And then you have a couple of write-up options that you have available. So with the research project, you're able to do a 5,000-word literature review and a journal paper for a peer-reviewed international journal. Or you can do an evaluation project, which is a 12,000-word evaluation report of a work-based public health project or health promotion program. And it is important to note at this stage that within this course, the focus of the Masters is always on a public health or health promotion related activity. So where would this take you and how would this benefit you? So in terms of employability and future opportunities, our plan and our aim is that this course will enable you and prepare you for a public health career in a very broad range. And as you can see here, there are some specific roles that have been discussed. I come from a public health background myself. I'm a public health nurse, and I have had the opportunity to work in community development within global health. I've worked overseas and I've worked in Northern Ireland as well. And the skills and the knowledge that you will gain from this course will open up many doors to be able to work within this field. So how do you learn? Well, I think one of the most important things to be able to discuss with you today is actually that engagement is critical in this course. And in many ways, the engagement that you do with this course is what you will get out of it. The more that you work with the course, the more that you actually engage with us as staff and with the materials, and the reading that you do through independent study will benefit you over the longer term. We do our utmost to provide a supportive environment within the classroom and to give you opportunities to be able to ask questions, to be engaged in discussion. There are lectures and there are also classroom-based workshops as well. A key element of working as a public health practitioner is actually to learn and develop the skill of reflection. And reflection is very much an element of this course as well. And we will both encourage you and support you to develop those reflective skills. There's quite a bit of self-directed reading, and we will be guiding you and encouraging you to start your reading journey and to be able to work out the direction that you want to go in, the kind of reading that you need to do, and as I said, to develop those critical analysis skills through that process. But also, as we're hoping to go and planning to go back to peer learning, this will also provide you with an opportunity to learn from each other. And that can be a very valuable element of the course. As you come from different contexts, as you come from different environments and different backgrounds, actually learning from each other is a very helpful part of this course as you learn together. And then you will also be able to embrace the academic challenge of critical analysis and criticality. Being able to take a piece of evidence and to be able to understand both the strengths and weaknesses of that evidence, to be able to explore the methodological challenges perhaps within it or the approaches that we used, and to be able to see both the learning that comes from that and perhaps where you would do things differently. What other ways do we use to help you to learn? Well, we've already talked about reflection. We also do thought showers. We look at integrative learning, that application between theory and the relationships of those theoretical models and theoretical frameworks that exist between the modules, but also between the modules and your practical learning as well. We really do encourage collaborative learning. The opportunity to work together in group work and to learn from each other is very valuable. And then as lecturers, we would also give you feedback and encourage peer feedback as well in the most positive way. And part of the way that we do that is also through this methodology that we call feed forward. And I'll talk about that more in a few moments. Finally, within this, you also have access to Studiosity. And if you go onto our website and look at Studiosity, you'll realize this is a great resource for you to be able to support you in your learning. So all the modules are assessed through coursework, and that will be through a range of essays, reflections, and journals. You'll have opportunities to do video presentations and also class quizzes. You'll do annotated bibliography and really learn the importance of that skill of being able to take information from different sources that you've read and to be able to combine those and analyze those as well. You'll be given the opportunity to do a policy brief and business case as well. And then there will also be some class tests with multiple choice questions. And all of those will then lead you to the place where you'll be able to embrace and begin your master's research project itself. So I've mentioned already this concept of feeding forward, and one of the things as lecturers that we try to do with you is to be able to give you information as we're giving you feedback in class and on your assignments and the submissions that you do, that actually will inform your learning from the process that you have been through on each assignment, but will also inform you for future reference as well. And so it's the building blocks of moving forward as you move through the course, feeding forward into your knowledge and the development of your skills. We'll also hold class discussions and debriefs. There will be comments on assignment scripts, as well as individual feedback that will be given in relation to the rubrics too, as well as general feedback within lectures and within the classroom activities. And finally, you will be given formal feedback at times as well for formative assessments, which will then lead in to your final assessments. So if you're thinking about this course, what kind of commitment would you need to be thinking of? Well, I think first of all, if you're looking at doing this course is run over 3 semesters within 1 academic year. And so you do need to be aware that actually this goes right through an academic year across the 3 semesters. If you're looking at doing the course part-time, then it's a 3-year academic program that's run across 7 semesters. If you are able to invest the time and energy and you get a pass with distinction, that means that you would get an average of 70% across the modules and at least 70% in your research dissertation. If you pass with commendation, that would be an average of 60% across the modules and at least 60% in your dissertation. And if you're able just to pass at 50, then you get your master's. There's no condonement, and with failed modules, students can resubmit on 1 occasion. In line with the university regulations, this may mean but that your completion date for the course, it can be extended or is extended as well. So whenever we're talking to our students about this course after they've been through it, what kind of feedback do we get from them? And this is just a couple of examples of students that did the master's course and just really felt that the value of doing the course actually made a significant difference to them in terms of their future journey and their future plans as well. As you can see, even from this information session, you can understand and see the breadth of information that you'll be learning and the knowledge that you will gain from this. And our hope through this is that, as these students told us, that actually this course will become a platform for you to be able to decide your own path within health promotion or public health, and that it will give you the skills and the abilities to move forward into an area that you are both passionate about and that you love, but also that you become confident into. So how do we ensure the quality of the course? Well, the course is evaluated and refreshed every 5 years. It's subject to monitoring by Ulster University and by the external examiner as well. There are examples of quality assurance processes. We have a course committee that reviews the course on a regular basis throughout the academic year. We have online module evaluation and student evaluation as well, and that is fed back to myself as course director, and then that's also fed back to the course committee and the external examiner too. And we have postgraduate taught experience survey too. So what other kind of resources are there available at Ulster University? Well, within teaching, you will have access as a student on this course to online platforms. In the same way with other courses as well, you will have access to online platforms, and you will also have access to course director and the teaching teams, and we can be contacted via email or via phone as well. You'll be given support of a studies advisor, and you will also have support from the school office, and so any questions that you have, you can call into the school office or contact the school office too. And then also you have library, and library has a significant number of online resources as well as the actual physical library. And as I've mentioned already, we are aiming and planning to go back to face-to-face teaching this semester, but over the last 18 months, Ulster University has invested a great deal on online resources too. And you will also have access to a librarian, and that is particularly invaluable whenever you're moving into your thesis and moving into your master's research project, to have access to an expert librarian who will be able to guide you through search processes for your literature reviews, and to be able to really help you to navigate through the resources that you'll be exploring. Other resources that are available within Ulster University include the Students' Union, as I've mentioned, the course committee. We also have a chaplaincy. There's a considerable amount of information on the Ulster website in terms of both student life, access to different resources within the university, and things like the ethics portal as well. You'll have access to the global team, and also if you're coming as an international student, you'll have access, as in addition to Studiosity, you'll also have access to our CELT team. And our CELT is our Centre for English Language Training. And so all of those are built up to give you as much support as a student at Ulster University as possible. So we are excited, as I've mentioned, to say that our new Belfast campus remains on schedule to open its doors and to welcome students from September 2021. And there are quite a high number of courses that are transferring from the Jordanstown campus to the new Belfast campus. And those can be found on the ulster.ac.uk website. But as I have mentioned, this course will continue to be delivered for this academic year within Jordanstown. We also recognise with the impact of COVID-19 moving into and continuing into 2021, our university has continued to work very closely with our contractors at the Belfast campus to try and mitigate the impact of the pandemic on the opening date, and that is ongoing. And as we can't deny the impact of COVID, we're continuing to work very hard to operate safely. As we continue to navigate through this pandemic. We've learned an awful lot over the last 18 months to 2 years, and have a shared experience and success over 2 extraordinary academic years where we have shifted a significant amount of our learning onto online. But we will now continue to work as much as we can towards adapting and continuing to deliver teaching to mitigate against the consequences of the pandemic. And we continue to work hard to be able to present and offer courses that are agile and responsive within this current public health context. And to be honest with you, now more than ever, public health is needed and recognised as the valuable resource that it is within this context of COVID-19. And what an opportunity to be able to explore that within this course. So we would really hope and expect to be able to welcome our students back in this year, to be able to create a safe learning environment, but also an enjoyable student experience for you into the following year as well. But obviously this is subject to government and public health guidance that's in place at the time. But you can keep up to date as the situation changes by visiting ulster.ac.uk/coronavirus. So thank you for taking the time to listen to this today. It's been great to be able to talk to you. I hope that as you've been able to listen to this, you can hear the passion that we have for this course, the enjoyment and the value that we place upon this course. As I mentioned, my background is in public health, and I am excited to be able to spend time with you guys and to be able to explore your knowledge and understanding of health promotion and public health. But if you have any questions, please don't hesitate to get in touch with me. My email is l.dornan@ulster.ac.uk, and you can see my phone number here as well. So please drop me an email or send me pick up the phone and give me a call, and I'll do my best to get back to you as soon as I can. And finally, if you are interested, we would be delighted if you would sign up for our webinars. And these can be found at ulster.ac.uk/PG events. So I look forward to hopefully welcoming you to Ulster University and to your future postgraduate studies. Thanks very much for taking the time to listen. Take care.